Alright guys, so it's been about 3 weeks since Anya's open heart surgery, and figured we should do a follow-up. So she had a follow-up visit, I think it was Tuesday this past week, and they said everything's looking really good. They did an EKG, ultrasound. They said there's no fluid buildup and everything looks good. So she's still on the Lasix just to make sure that no fluid builds up. Can you be quiet? And we're gonna slowly wean her off that. So, all right. So let's see this incision line, okay? So they said that this is just gonna peel off, kind of like sunburn. So it's looking pretty good so far, and that's where the chest tubes were in. What? No. Okay. What are you saying?
Gonna take it off.
It's gonna come off by itself? Yeah, I'm not gonna touch it. Okay, let's get you dressed, okay? Alright, so every morning Anya gets 10 milligrams of Nexium because she gets really bad reflux. 15 milliliters of water and a flush. So let's give this to her. We usually give it to her about 30 minutes before she gets her first feed. Alright, you ready? Here we go.
No, please don't. No. What is this?
What is that?
Why is this not working?
Because there's no water in it. Gotta have water in a water gun.
Ow.
Flush, 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 flush. Alright, all done, and then we'll eat in like 30 minutes, okay? Gremlin!
We're gonna have a tea party.
Tea party, let's do it.
Okay.
Alright, so we are gonna make some formula here. And we will start with, let's see here, 12 ounces of water. Okay. We have 7 scoops of Baby's Only Organic Soy formula, toddler formula. Okay. All right. There's one. All 7 are in. Now, time to shake it up. Okay. All right, up to 180. And we get 3 teaspoons of rice cereal. All right, last thing that goes in is a couple scoops of yogurt, and we use an organic yogurt called Yo Baby. All right, here we go. All right, mix it all up. And then we are doing, let's see here, 1 milliliter of furosemide or Lasix, and this is, she's taking this just to avoid some fluid buildup after her heart surgery. So we're gonna grab about 5 mLs here of baby water for a flush. Alright, first thing is the Lasix. Can you pull that shirt up a little bit?
No.
Thank
Can't
you.
see.
Well, there you go. Lasix first. Okay, next, gonna get the tubing hooked up here. Okay. Alrighty. Alright, almost done. All done. Can you hold that, please? Thank you. Gonna disconnect and flush. All done. So Anya gets 5 feeds a day, 185 milliliters, and we can skip them if she eats enough by mouth or if she drinks enough. So we usually get to skip 1 or 2 a day. The goal is to eventually get her eating enough by mouth and drinking enough that we can get that button, Mickey button it's called, removed. We're on feed number 2, so she gets a feed every 3 hours. We did one at 9, it's around 12 now. So for the 12 o'clock feed, she's gonna get a 1 tablet baby aspirin. And then we flip-flop every other day between cephalexin and a macrobid, and that's because she was getting a lot of UTIs when she was first born. And of course, then we have her next feed. So let's get this all mixed up. Alright, we're all mixed up and ready to go. We're gonna do spot check on Anya's oxygen saturations here. So let's turn this thing on here. I think I got it upside down. Alright. Let's see. And let's see how we're doing. So, most people's oxygen sats are between around 96 to 100. And before Anya's Fontan surgery, she was satting around, I would say like 83 to 85. And right now, let's see. So right now she is at 87, I think it said. 88. Anya, that is a cute shirt. Who got you that? Dada. I got it.